Anticoagulation with or without Clopidogrel after Transcatheter Aortic Valve Implantation. Definition: the role of anticoagulation alone or with an antiplase agent after transcatheter aortic valve implantation have not been well studied.
First thing that we can see is the severely calcified aortic valve with restricted opening. We can also establish on this picture that there's probably moderate LV dysfunction.
We're now going to pull the system back out of the artery and retrieve those sutures. We're going to make sure that we get the whites and the greens opposite to each other. We're now going to put in a long 14 French sheath. If this was a 34mm valve, we'd need to be putting in a 16 French sheath. We'll follow it in, because there is certainly some resistance with that calcification there. And that's just gone through, so that's feeling comfortable. We're always going to follow the tip of that sheath to make sure we don't come off the wire. We'll pull that back into the sheath, take that out, and we've now got good access. Tony is just finalising loading of the valve there, so we won't actually do our valvuloplasty until that happens. The valve itself is housed inside the capsule here. Waiting for pressure to drop. That's inflate, inject, deflate, pacing off. So we'll just let that loop now. We'll get the balloon out of the valve and bring it into the descending aorta. We're just waiting for our hemodynamics to recover, which they've done. Stephen, we'll start to just slowly flare this valve. So it's a good spot to be. So start to flare a little. So let's pace at 180, please. Stephen, go ahead. Keep going, 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 keep going. Pacing off. Fluoro save. So VP's come back nice.
Application is yours. The target access site was the most common location for beveling, but not producer bleeding was also reduced with
TAVI means Transcatheter Aortic Valve Implantation. It started in France and it's been every major Western and Asian country. So it's a process where we implant a new aortic valve, which is one of the main valves in the heart, through a catheter. And basically we can insert this catheter through the main artery in the groin and push it up into the heart and deploy the new valve in where the original valve is. And basically it's indicated for people with symptomatic but severe aortic stenosis, which is a narrowing of the aortic valve. Traditionally, treatment involves open heart surgery. It puts a lot of stress on the body, and we feel that in certain patient groups, they are much better off having a less invasive procedure. And these people would include those over 80 who we feel are clinically frail, or they have other health issues that might cause complications after they have their heart surgery. The way the procedure works, basically it involves passing a valve which is already pre-mounted onto a delivery system, and it enters through the femoral pulse or through a small cut in the chest, and we cross the disease valve and deploy the new valve there. The procedure is done without bypass, so that means that the heart is still pumping, and once the procedure is completed, it can go to the ward the same day without having to go to intensive care.
For the community of Geelong, or in fact the Southwest Victoria, I think this is exciting news, whereby such a procedure previously was only available in Melbourne. Now that with such a technology and service available in Geelong, it has certainly actually reduced the patient needing to travel all the way to Melbourne. And not only that they
pros and cons. In patients undergoing TAVI who were receiving oral anticoagulation, the incidence on serious bleeding over a period of 1 month or 1 year was lower with oral anticoagulation a long time with oral anticoagulation plus clopidogrel.
Okay, hi everyone. We're starting here our first case of the day. I'd like to introduce our team here. We're going to do a core valve Evolut R here, 29. To start introducing the team, I have Sandeep Patel, who is our interventional fellow. He does the structural heart fellowship, as well as Brandon Elmore. I have Maria Zuli, who works with us. She's a technician, and we have as well Alicia here, we have Jan from Medtronic, and we have Amy here. She's hidden behind me here. Sorry, Amy. And we have, of course, Dr. Ono, who is here with us. It's a great honor to have Yohei here during the case. And we hope this case is going to be very helpful, and I hope you guys enjoy this implantation of Evolut R. As you can see, we're in the cath lab. This is not a hybrid OR. So our patient is awake and very mildly sedated. And we gave, of course, local anesthesia bilaterally here and very mild sedation. So that's what we do for every single case, as long as it's a transfemoral case. And we're going to proceed. We're going to start per closing. So importantly, you have to remember that the Evolut R comes with an inline sheath. So this valve actually goes. And to achieve an optimal insertion in the groin, it's very important that we open very well the subcutaneous tissue, okay? So we're going to start to per-close.
It should apply to equal. We performed a randomized trial of clopidogrel in patients undergoing type B who were receiving oral anticoagulation for appropriate indication.
The transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's severely calcified and the leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve and placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve. The balloon catheter is then inflated, opening up the stenotic valve, cracking the plaque, and freeing up the leaflets. And that's in preparation for the stent valve, or the transcatheter valve, to be inserted. And the first rendition that you see is the first stage of the catheter going in, and then the second stage of the catheter coming through around the aortic arch, over the wire, and it's going to insert into the stenotic valve. Once the catheter is placed in the valve, the stented valve is ballooned open, pushing the diseased leaflets out of the way and leaving a functioning aortic valve in place. And then the wire is removed, and you can see the leaflets of the aortic valve opening and closing, providing normal flow through the valve. The TAVR procedure,
Conclusion. In patients that were receiving oral anticoagulation, the incidence on severe bleeding over a period of 1 month or 1 year was lower with oral anticoagulation a long time with oral anticoagulation plus clopidogrel.
Hey everyone, it's Franz from MedMastery. I thought I'd do another video review for you of publications in the field of cardiology, very recent publications. And the first one deals with the rising incidence in atrial fibrillation over the last 50 years. The second one is a comparison of transcatheter valves versus surgically implanted valves in patients who are not at very high operative risk. And the third publication compares Clopidogrel for 6 weeks versus Clopidogrel 6 months in patients who already receive anticoagulation and aspirin after stent implantation. So check them out.
The first trial I want to talk to you about was published by